Hello, everybody. Thank you for joining us tonight. I know there was quite a number of individuals who wanted to hear a talk on brain fog, and as a board certified neurologist, this is something that I frequently will see in the office. So I believe it would be appropriate to go over, what exactly is brain fog, what type of conditions can cause it, what if anything we can do to treat it. I'll try to be very general and as the evening goes on. If any specific issues, come to mind, jot those down. And later, you'll have time to ask me questions, and I'll answer those to the best of my ability. So, what is brain fog? What are the possible causes? And if we even if we don't know what the causes are, is there anything we could do to help improve a patient's symptom who's having brain fog? And that's really what I want to hopefully do today. Go over the possible causes and what can we do, if anything, for your particular uh, problem. So what is brain fog? It's actually a commonly used term that describes certain symptoms that a patient can experience, but it's not actually a true medical diagnosis. It's not really a technical term that we use in medicine. It is just a expression or a description of what a patient can experience. I tried to look into this to see how old this condition is. Is this something that's just come to light recently, with the advent of COVID and many patients with long haulers that have residual post-COVID symptoms? The whole concept of brain fog has become much more common, and many people are experiencing it. But I found in researching this that this has been a problem that's been around for, you know, for centuries. There was one sighting that I found back in 1858. A British physician, James Turnstall, first used the term brain fag, and he used it to describe mental exhaustion. And he saw that in what he described as brain workers, folks such as lawyers, writers, teachers, students who experienced a consequence of overstudying, and they described this as this brain fag. In the 1960s, it was actually used as a proper diagnosis amongst psychiatric illnesses, and it was labeled brain fag syndrome. And this was part of the compendium called the DSM-4, which is a listing of all psychiatric illnesses and the specific details of each illness. And again, this was primarily described in that uh, compendium as excessive academic strain. But we obviously know now that it's more than just academic strain. It's more than just overworking or studying too much, or working too long as a lawyer or accountant or a bookkeeper. What do most people experience when they have brain fog? And again, this is a difficult uh, thing for people to voice. When I see people in the office that complain of this, they always have trouble coming up with the right adjectives, the right terminology, the right ways of expressing what they're experiencing. I think most individuals tell you that it's a cloudy feeling. Their brain feels fuzzy. They can't really think clearly. They have trouble focusing and concentrating, and it can involve short-term and long-term memory. Many of my patients tell me they have trouble understanding new information. They have trouble retaining it. They have trouble using it. They have trouble learning new information. Uh, Probably the most common thing I hear is, I'm having trouble recalling names. I'm having trouble recalling words. I could be mid-sentence and suddenly come to a mental block where I can't come up with a word. I forget what I was about to say. I went to go do something and I forgot why I walked into the room. Oftentimes, patients will also say that they're more forgetful in other ways as well. They forget how to do things they previously knew how to do, or it just seems more difficult for them to do it. And many times, patients will describe difficulty performing more than one task, or something we refer to as multitasking. So these are just some of the more common things that I've seen and have been written about, with other researchers that are doing this. We're not researchers in this particular area, but I did the research to try to find out as best I could, what are we finding as the latest breaking news as to what's causing this? I think the big question most people who experience brain fog is, well, can you treat it? Can it be fixed? Well, most individuals with brain fog can be treated. However, you need to know what you're treating. You can't treat or cure a problem unless you know what's causing the problem. That's in any medical condition, certainly in the world of neurology. Patients come in oftentimes with vague symptoms, memory problems, balance coordination issues, visual problems. They don't know if they've had a stroke. They don't know if they're developing some kind of early dementia, but they have these common symptoms that they know are not normal, and they need an answer. Yes, we can treat it, but we need to first find out what's causing it. Number two, if we can identify the cause, we can fix it, we can treat it, we can work on it, we can do our best to make it better. Can everything that causes brain fog be reversed? No, not everything, but many things can, and that's part of what this presentation will show. What if I can't find a cause? What if our tests don't give us an answer? The story, doesn't lead to a specific diagnosis. Test results come back negative. Can we do anything about it? Yes. There are treatments, even for folks who have these symptoms without an obvious explanation. Those who have tried to get medical attention, tried to determine where it's coming from, we still can have improvement and or resolution of the symptoms. But again, the real goal is to find out, well, what is really wrong with you? What problem is causing this? Can it be reversed? Can it be remediated in any way? Or is it just a matter of chronic symptomatic relief? Well, we're going to talk about that more. So what are the possible causes for brain fog? I wanted to go through those which are the most common, those which anyone in this room or anyone that's listening might experience from various medical conditions or situations. And if you're somebody who's actually experiencing brain fog, think about these things. Have they been looked into by your treating physician? Have they been considered? One of the more common causes that I find for brain fog or mental fuzziness or trouble focusing and concentrating and forgetfulness are hormonal. How many women that are listening here are perimenopausal or went through menopause and experienced a period of time where they had trouble thinking, they had trouble focusing, they had trouble concentrating, they felt forgetful, especially in the menopausal time when many of us are 50s or 60s are getting forgetful, and you start to worry, gee, do I really have Alzheimer's disease? Is there something else going on? Well, what I think is really interesting is some of the work that I looked into about perimenopausal and menopausal memory impairment all reflects the hormonal fluctuations that a female will go through during this change in their life, specifically related to estrogen. Everyone knows of estrogen as being one of the hormones that allows a woman to develop, allows you to have, the normal features of a female, to maintain your body, your skin, your hair. It allows you to be productive, reproductive. But what I think most people don't realize is that estrogen affects our body in many other ways that you may not know about. Estrogen plays an important role in the way the brain carries current and how the nerves in our brain, the neurons, carry current in very specific parts of the brain, specifically the very front of the brain, the prefrontal cortex, and then deep in the brain, something called the hippocampus. These are areas of the brain that are involved in memory. They have other things that they're involved in as well. Probably the most prominent other uh, factor in those areas is emotions. So it can affect our memory. These areas can control our memory. They control our emotions, and estrogen has a way to modulate or regulate conduction along the nerves in these two areas, influencing how these nerves respond. These areas, uh, think of them as regulation centers that bring together many different types of memory. Memory isn't just things that you think about. Memory also relates to things that you've experienced, things that you have felt. So there are things that you've smelled, so there's odors that you have memory. There's things you've heard, sounds that you have memory. There are tastes that you have memory. There are sensations or feelings, things that you've touched that you have memory. There's emotions that you have memory. So the prefrontal cortex and the hippocampus take these different types of memories, bring them together. And I think everyone that's listening has had experiences where you have seen something or smelled something or tasted something, and it brought you back to an experience you've had somewhere back in your life. You may smell apple pie and suddenly remember what it tastes like and think about your grandmother's home and get that warm and fuzzy feeling in throughout your body. Or you may have a certain vibration that you touch and it brings you back to a frightening experience or an accident or a mishap that you may have had, and all the other feelings and memories that went along with it. So it modulates, it alters our memory. It brings together not just the thoughts, but the feelings, that involve every one of our senses. So the estrogens actually modulate that. And remember, it's not just women who make estrogen. Men make estrogen as well, just like progesterone. Both men and women make progesterone, but obviously women make much more than men. The other thing that I think is really fascinating is that estrogen is important in developing branches of the nerves. The nerves themselves, like wires, carry current. They receive signals from other nerves around it, and then they carry these signals and turn on additional nerves beyond where they're located. So the estrogen allows us to build something called dendrites. Dendrites are the little fibers, little almost like hair follicles that receive signals from surrounding neurons. It activates the neuron, and then it causes that neuron to send signals to other neurons. So the more dendrites that the estrogen allows us to have makes us much more sensitive, more easily stimulated and or altered by the surrounding other neurons. And that has consequences, not just with memory, but also with emotions. It allows us to react, more quickly. We believe that many individuals who are highly intelligent have greater development of these structures, the dendrites, as well as other supporting structures around the nerve itself. See, the brain isn't functioning exclusively because nerves are carrying current like wires. There's also some other players that are supporting it, like the glia, that can also be influenced by the estrogen. Basically, structures that support these neurons. So the hormonal fluctuations absolutely can alter us. I think anyone who's had migraine headaches, female, can also relate to this. In the premenstrual time frame, many times the sudden shift in estrogen to progesterone levels can bring on migraine headaches, can also bring on moodiness. The whole, PMS symptomatology is because how the estrogen affects not just the nerves in the brain, but other parts of your body as well. So it's has a lot more to do than just our female development. What about nutrition? What we eat is what we are. We are what we eat. The healthier we eat, the healthier we keep ourselves, the healthier our whole body functions, including our brain. I find that the American diet oftentimes is deficient in many key elements. We're no longer growing our own food in the backyard. We're not frequently farmers that go out, we pull up our vegetables, we rinse them off, we eat them fresh, or we cook them, we eat them right away. Instead, food is grown areas that are far from us. They're shipped in. There's a prolonged period of time where these uh, may deteriorate and lose many of their nutrients. These foods are then washed. Many of the vitamins that we need that are most vulnerable uh, and necessary for nerve health are water soluble. They can get washed out when these foods are prepared, especially commercial preparation. These water soluble vitamins can break down. They can be flushed out of the system. Even something as simple as keeping them fresh and vibrant in appearance in the supermarket. Every time they sprinkle it with the water, again, you're putting some of these vegetable vitamins at risk for being flushed out. Then we put it in a pot of water, we boil it, we flush out the B vitamins. So what I'm trying to say is, we have to begin with the potential of deficiencies in our diet because we're not growing the food. Many of these foods are from elsewhere and they're allowed to deteriorate just because of prolonged time and or the way they're kept and then how they're prepared. Many times food are now artificially grown in hydroponic ponds and they aren't getting all the trace minerals, elements, and vitamins that we would have otherwise received from the soil. So across the board, all of us really have to be careful. Are we eating healthy? Are we getting all the nutrients we need? Are we supplementing ourselves appropriately? I've mentioned B vitamins quite a few times because B vitamins, the whole gamut of B vitamins, are critically important in maintaining nerve health. These are critical building blocks in growing nerves, in maintaining the integrity of the nerves, and healing damaged nerves. One of the more vulnerable ones is B12. Vitamin B12 is a real problem because it isn't as plentiful as we'd like. Yes, it's in meats, uh, especially the red meats, but it is something that is difficult for individuals on certain diets. If you're somebody who's trying to eat mostly vegetarian, you could frequently be deficient in the B vitamins, especially B12. How the vitamin is absorbed through your body also, plays a major role. B12 has very limited absorption sites. It's absorbed primarily from the gastric lining, the lining of your stomach, not your abdomen, not your intestine, but the stomach itself. So if it doesn't get absorbed there, very little of it is going to get into your body. It can also be absorbed under the tongue. That's why some of these B12 supplement vitamins, if any of you are taking it, you put them as liquids under the tongue and you have to hold it there, for a prolonged period of time to get them to be absorbed. Any condition that affects uh, your gastric motility, any kind of condition that can scar the lining of your stomach, can interfere with your ability to absorb B12. For example, people who have autoimmune or inflammatory diseases, we inherit the risk of an autoimmune disorder. We don't always know what that autoimmune disorder is going to be, but they tend to run in families. For example, rheumatoid arthritis. You may have had a mother or grandmother with rheumatoid arthritis. You run the risk of autoimmune disease. Is it necessarily rheumatoid? No. It could be inflammatory bowel, Crohn's, psoriasis, diabetes mellitus, hypothyroid. You run the risk. And there are autoimmune conditions that cause inflammation of the lining of the stomach, interfering with its ability to absorb B12. It also interferes with certain specific receptors that the B12 binds to prevent absorption. If somebody uses alcohol on a regular basis, that also can damage the lining of the stomach, interfering with the absorption. What about somebody who has gastritis or somebody who's had ulcers? Or what if somebody has, frequent motility and they have, recurrent diarrhea and there's a more quick passage of food through their gut, or somebody who's had a bypass or a sleeve, where there's less time and or less contact with the lining of the stomach to absorb it. These are all different conditions, but they all have the same common denominator where the B12 is just not getting absorbed. And B12 isn't the only important vitamin. The other B complex is also just as important. Uh, so if you look at your diet and see, am I getting enough? And if not, at the very least, take a good B complex supplement. just to, enhance your protection that you are getting what you need. Anemia is a common thing. Anemia most often iron deficient. Why is that important? Well, we need the hemoglobin and hematocrit to carry oxygen to our body, to everything, including the brain, which I'm talking about today. If you're too anemic, you're not getting enough oxygen to your brain. It's going to interfere with your brain's function. You can feel lightheaded. You can feel the mental fog that we're describing today. You can have generalized weak, shortness of breath, poor exercise tolerance. Uh, and uh, it also can reflect other underlying medical conditions that need to be explored. Somebody with anemia needs to see a physician to find out, is it a vitamin deficiency? Is it iron deficiency? Do I have an underlying autoimmune inflammatory disorder? Do I have an underlying cancer? Is there something else that hasn't been found? Is this just a marker uh, of something which is the tip of an iceberg of something more serious? And these inflammatory conditions absolutely, even themselves, can damage the brain. How? Somebody with an autoimmune disorder, it means your immune system is attacking you. Our immune system is supposed to be on guard to fight against invading organisms, bacteria, viruses, uh, parasites, cancer cells, you name it. But sometimes, if you inherited an a defect in your immune system, then your immune system, when it gets turned on, uh, overreacts. And then you develop uh, antibodies or other proteins in the body that attack not only the organism that entered the body that it was intended to kill, but also our own body. Many times the proteins, especially the proteins lining our nerves, look very similar to viruses. So if you have antibodies that are turned on because of an inflammatory disorder, it can attack our own nervous system. Infection, same thing. The immune system gets turned on, and sometimes it overreacts and it starts attacking the proteins in our own body, especially in my world, the lining of the nervous system, and causing it to be defective. COVID is probably the one reason why most people have asked me to do this presentation. COVID, as you all know, has been this very unique, very unusual, very frightening disease that keeps morphing. It keeps changing. It keeps altering how it presents. It can affect every organ in our body. As a neurologist, we have seen it involving every aspect of the nervous system, brain, spinal cord, all the nerves, the peripheral, the ends of the nerves leaving your spinal cord. It can affect the muscles as well as every other organ in your body. So COVID can affect us in many ways and produce this brain fog for many different reasons. We are seeing a significant number of individuals who have had COVID develop what is now referred to as long haulers or long COVID. These long haulers are individuals who have prolonged post-COVID symptoms that linger for weeks, months, years. There is no marker, there's no indicator that we can see that has been found to identify why an individual would have this prolonged post-COVID consequence occur. They're obviously researching this extensively, but we have not identified it yet. We know that the COVID has some very severe and direct damaging effects on the nervous system as well as other organs and other tissues in the body. There are also some secondary effects from COVID. So let's talk about it. Uh, the COVID virus can actually enter the membrane, the lining of the nerves directly. It has this very specific, what's called a spike protein that penetrates the membrane, the lining of the nerves, and its insulation. It damages the insulation, just like if you strip the wire, you have this raw nerve ending that's no longer insulated, that's going to spark, that's going to send static signals. So it can damage the lining of the nerve, It can directly damage the membrane or the casing of the nerve, the body of the nerve, the cell itself. And it then enters the contents of the nerve cell, and it utilizes the material inside the cell for its own purposes. It uses the nutrients, it hijacks the mechanisms that the cells have for the sole purpose of replicating the virus. So it can destroy a nerve, it can kill it. It can then allow that damaged nerve to be a new host to support growth of additional viruses that can allow it to then penetrate adjacent nerves, and it can spread through the nervous system, causing direct damage to the nerves. And this is how we see permanent and irreversible brain damage occurring in those individuals who have died from COVID. Pathologic um, studies in these autopsies have shown this. We also see the the COVID virus at times just interfering the lining of the nerve, causing the lining to be stripped. The lining of the nerve is this fatty protein mix. I think of it sort of like almost like a gelatinous material, and it can be broken down. And now you have these nerves that are exposed, that are, as I said, are stripped. And a stripped nerve, like a stripped wire, can't carry current normally. So what that nerve did for a living no longer is going to happen. It's also going to cause what they call fusion of nerves. They have seen in studies where the COVID virus can cause nerve fibers to melt together or fuse together. It damages the membranes, the nerves themselves become glued together. So then, when a nerve when you try to turn on a nerve and a nerve tries to do its normal function, instead of one nerve doing what it's supposed to do, having its designated consequence, instead, it's turning on many different nerves that just happen to be in close proximity, doing random and sometimes unwanted stimulation of other nerves. So it interferes with the normal signals going through the brain. And this could either be temporary or permanent, but it looks like those nerves that are fused together, these masses, those cells, if they're still functioning, are going to die in due course. So those are not going to be reversible. And they are seeing this again in the more severe cases of injury to the brain. I mentioned severe cases. Does this mean this only happens in severe cases of COVID, only those folks that were hospitalized and on ventilators and had severe, lung damage or heart attack or other consequences? No, no. We're seeing this post-COVID brain fog and these changes in milder forms as well. So it does not need to be a severe form of COVID to have these kind of reactions occur. It could be a direct invasion of the nerve into the direct invasion of the virus into the nerve that damages the nerve itself, the lining of the nerve, the membrane of the nerve. It can kill the nerve, cause it to fuse with other nerves, and prevent it carrying current. It can also be the immune system's reaction to the COVID virus that does the damage. As I said earlier, our immune system is intended to make special proteins to attack these organisms that are invading our body. But sometimes the immune system overreacts, and we get these protective proteins, these antibodies that are then attacking our own body's protein, causing it to be damaged. And we see that looking very much like what we see in conditions such as multiple sclerosis, where the lining of the nerves are stripped, the current itself can't carry normally as it should, and it interferes with the nerves functioning. The COVID can also affect the nervous system as a consequence of injury to other organisms. COVID affects the heart, COVID affects the lungs, it affects the kidney, can affect the liver. As a consequence of damaging these other organs, you can have metabolic or chemical changes in our bloodstream that then negatively affect our brain. For example, if the heart is injured, it's not allowing it to pump adequate supply of blood to the brain. It's limiting its oxygen. It's limiting its nutrients, and interfering with the brain's functioning. It affects the kidney. It interferes with the kidney's ability to excrete toxins, causing these chemicals, these toxic waste products to build up. These waste products, when they build up, are like drinking too much alcohol. They intoxicate you and interfere with your brain's function. If it affects the lungs, it interferes with the oxygenation of the blood, and how much our brain is then going to be receiving or deprived of the blood. And COVID isn't the only virus that does this. They have shown in virology studies uh, for decades that other viruses can do these same kind of changes. You all have heard of these other viruses, things like rabies, been around and known for years, for centuries, as deadly. And it does exactly what the COVID can do when it enters the nervous system, stripping these nerves of their lining, damaging the membranes, killing the nerve directly, causing them to fuse together, acting as a host to build more viruses and expand, the infection to other parts of the body. These viruses also don't just affect your brain, they also affect nerves elsewhere in your body. I think, oftentimes individuals will have numbness and tingling and pins and needles, along with things like the mental fog. And that's because these same insulting viral particles and or the body's immune system's overreaction to it are damaging not only brain cells, but also cells at the end of your nerves and your arms and your legs, so that your hands and feet are also affected. It's all manifestations of the same problem, but different organisms showing, I'm sorry, different organs showing different symptoms. What about mood disorders? How do they play a role in brain fog? Anything that's going to distract you, anything that's going to decrease your ability to focus, to concentrate, anything that's going to cause your brain to constantly run, something that's going to not allow your brain to shut off, not allow your brain to have a deep, restful relaxation, healing, uh, sleep. Any of these mood disorders can cause distractibility, impaired focusing, impaired concentration, either because the brain itself is being overstimulated in what's called a fight or flight response. We have this involuntary nervous system that can get turned on normally in certain circumstances. For example, you're at war, you're being attacked, there's a monster running after you, some catastrophic event just happened. It turns on our involuntary nervous system, and we get this fight or flight response that allows us to normally uh, react in those horrific situations. Our heart rate goes up, our blood pressure goes up, our pupils get really widely dilated, we can see more clearly, we're hypersensitive to everything around us. But in some individuals, especially those with anxiety, and bipolar disorder, with panic attacks as well, we get this exaggerated fight or flight response that it can occur without provocation whatsoever, or an exaggerated response to even minor stressful situations. In this situation, with these uh, overactive adrenaline discharge, for one of another way of describing it, the brain is constantly running. You can't shut it off. You're constantly being distracted. You try to focus on one thing, and instead, other things keep hitting you. You keep worrying about other things. Other factors keep coming and disturbing or disrupting your thought process. We see it also with depression, where individuals, are ruminating. They're thinking constantly about other negative, uh, helpless, hopeless thoughts that prevent them from doing and accomplishing what they need to do in their daily life, at their position of employment, interacting with other individuals. So there's a great deal of distractibility with these mood disorders. It's not damaging the brain cells, it's just distracting them. And as many of you, I'm sure most of you recognize, these are frequently genetically inherited conditions. So you even know this in the family, that other individuals have had these same problems. You've seen it, I'm sure, in your life with other individuals you've interacted with. And oftentimes, if we see this, we can treat it in a number of ways, to get this under better control and try to prevent the distractibility that comes along with it. What about drugs? how many on this Zoom right now are on drugs? How many are on prescriptions? I am. I'm sure just about everybody else in this system right now is. Drugs are artificial chemicals that are in our body, and we take them for very specific reasons. But sometimes they have adverse effects, unexpected reactions that can affect our nervous system negatively. Oftentimes, it could be a direct uh, injury and or interference with how a brain cell carries current, how the nerves function. Other times it could be a buildup of a drug where it becomes a toxic level. I mean, something that you normally would take, to control whatever, your seizures or migraines, and you take too much of it, it becomes intoxicating to you. It can drop your blood pressure, cutting off blood supply to your brain. If the doses are too high, you're on a blood pressure medication. So many otherwise common, necessary medications can affect our head, can affect our thinking, and we can control those by trying to identify which which of these medications is doing it, but starting by simply thinking about, well, what am I on? And, do I need to be on all the drugs that I'm on now? Are the drugs interacting with each other? See, all these drugs that we take have to get out of our body. They're not natural in our body. Our body metabolizes them and excretes them. It metabolizes them through the kidney or the liver. Well, we only have one liver, we only have these two kidneys. So there's a limited amount of metabolism that can happen. And if you're on multiple medicines and they all have to be metabolized through the liver or the kidney, sometimes metabolism rates of certain of these drugs slows down. So these drugs tend to accumulate in your body. And taking certain drugs that could potentially make you tired, an anti-anxiety medicine, an antidepressant medication, an anti-seizure medication, a migraine medicine. If you're on other drugs, for example, NSAIDs, arthritis drugs, can sometimes interfere with the body's metabolism of those drugs that's affecting the liver and or the kidney negatively. So, think about it. I just want to try to, raise your awareness of what am I on? What can these things do to my brain? What can these drugs in combinations, do? Can it cause one or more of these things I'm taking to accumulate and negatively affect me? I think we see this most commonly in what's referred to as chemo brain. Individual on chemotherapy oftentimes will have this mental fog or this brain fog, and I think it's probably the most common thing prior to COVID that would cause this. Why would somebody on chemo have brain fog or mental fog? Well, for a lot of reasons. Chemotherapy, the purpose of the chemotherapy is to kill rapidly uh, developing cells, these abnormal cells, these highly metabolic, highly, rapidly growing abnormal cells are hijacking the nutrients in the blood supply of normal cells. And if we can slow down some of those rapidly growing abnormal cells and or kill them, we can control the cancer or the leukemia or the lymphoma. Uh, so the chemo can directly damage nerves. It can damage nerves by killing neurons themselves. The end of the nerves most commonly are affected. That's why many people who've had chemotherapy will describe a sensation of numbness or tingling or pins and needles in the tips of their fingers, tips in their toes, because the ends of the nerves where the circulation is least accessible, the furthest away from your heart, those are those nerves that are most vulnerable to any kind of injury. uh, that's where they'll frequently feel the numbness and the tingling. So chemo directly can damage nerves, and or the nerves can be stripped of their lining. So the nerve itself, the wire, the living thing is still alive, but the insulation has been stripped off. And we now have to, when the chemo is over, wait for that insulation to regrow itself, the myelin. Uh, and myelin doesn't grow very fast. Usually we think about myelin regrowing at about a half an inch a month. So if you're somebody who's had chemo and you're numb up to your knees, think about how long that's going to take to regrow. And, can we promise that it'll all regrow and it'll return to normal? Now, because there could still be nerve damage directly killing nerve cells and or insulation. What else does the chemotherapy do? It can affect other organs as well. We keep going back to things like the liver, the kidneys. These are organs that are also vulnerable to the chemotherapy that can be damaged. It can cause toxins to build up from those organisms, not those organs not properly eliminating our waste products. So chemo can affect us in many ways. What else? Well, many people who have cancer have mood disorders as a result in reaction to it. So we see anxiety, we see depression, we see sleep disorders, which further can complicate and interfere with our ability to focus and to concentrate. It can also affect our sleep patterns. Sleep deprivation can also interfere with our brain's functioning if the brain doesn't get a good rest, if it doesn't allow itself to regenerate, for neurotransmitters to be developed, it interferes with it. So somebody who's in pain, somebody who's worried, somebody who's anxious, somebody who's depressed, on chemo, with cancer, what's my long-term outlook? Am I going to survive? Can all have these negative effects. What other medical conditions can do it? Commonly, I see diabetes mellitus as a major player in mental fog and in change of mental status in general. Diabetes, with impairment in regulation of our blood glucose, we can see significantly elevated levels of blood glucose to the point where, think about it as the blood becoming like syrup. It's thicker. It doesn't move as quickly. It especially is slower traveling through the tiniest little microscopic blood vessels in our brain and the rest of our body called the capillaries, where normally these arteries, these blood vessels are so small that an individual red blood cell needs to go single file, in order to feed the cells that they're supplying. So if you now have this thicker, heavier, slow-moving, syrupy type blood flow because the sugar is through the roof, it's going to interfere with focusing and concentration. It also alters the water content in the brain. It alters what's called the osmolality. So, like a sponge, it's going to accumulate water. It's going to cause to expand and cause shifts that will interfere with how the brain functions. The diabetes also, as we talked about earlier, can affect other organs, going back to the liver, going back to the kidney, and negatively affecting the brain because of impairment there. Diabetes can also interfere with blood supply to the brain because diabetes can damage the lining of the arteries, causing atherosclerotic or degenerative changes to accumulate, causing cells to stick to it, which can put you at risk for stroke as well as heart attack. It can cause tiny little blood vessels to become picked off, allowing you to prematurely lose brain cells as a result, causing you to lose your memory, causing you to go on to conditions that look very much like dementia, if not properly managed. Thyroid disease. Thyroid, overactive and underactive thyroid, interferes with the metabolic rate of our entire body, including the neurons of the brain, how the connections work. Somebody who, especially low thyroid, there's slowing connections, there's interference, there's blocks, nerve blocks, which interfere with connections in the brain, interfering with our ability to, perform the necessary cognitive tasks that we have. Cerebrovascular disease, small vessel disease in particular, the tiniest little arteries can easily become plugged if you have high blood pressure, diabetes, cholesterol, sleep apnea, if you're a smoker, if you're an alcoholic, if you're overweight, or if you just inherited the risk of vascular disease, heart attack, and stroke. Our tiniest little arteries, as I said earlier, are extremely vulnerable of getting picked off, of getting plugged, because these arteries are so small. Any kind of injury to the lining of those arteries can cause blood cells to become obstructed, to prevent blood flow supplying brain cells, and we lose brain cells prematurely. I've mentioned liver and kidney multiple times already. Autoimmune diseases, the whole gamut. If you have one autoimmune disorder, frequently you're at risk for others. And if you carry one diagnosis and you have new symptoms, let your doctor be sure they're exploring all the other kinds of autoimmune conditions that might be causing your symptoms. But again, if the immune system is impaired, it can attack your own body, not just the organisms and cancer cells that it was intended to screen against and destroy, but our own body. And it's not just the joints, it's not just the tendons uh, or the bones. It could be the blood vessels. It can cause autoimmune diseases, can cause the blood vessels to be inflamed, something called vasculitis, and cause them to close off and cut off blood supply to the brain and other body parts. They can directly injure the nerves, causing inflammation, stripping of the lining, and or death of those cells. Sleep disorders, especially obstructive sleep apnea. Uh, if you do not have a restful sleep, your brain cannot return to normal functioning. Somebody who's awakened repeatedly throughout the night because of sleep apnea or other sleep disturbances, your brain can't function. Just like any other organ, I'm sorry, any other body part, you work a muscle too much, it's not going to function. These athletes that don't cycle their workout, they'll overuse a muscle, they'll injure it. Well, the brain's like that. That brain is not allowed to rest, to recuperate, to regenerate the tissues of the brain, to allow the neurotransmitters to reaccumulate. You're not going to function normally. Sleep apnea also, when you do suddenly stop breathing in sleep apnea, there's a sudden spike in your blood pressure, this sudden hypertensive crisis that can damage the lining of the arteries, predisposing you to stroke and/or hemorrhage. It can be pretty serious. So somebody who has this, uh, absolutely is at risk for consequences. In addition, sleep apnea, you don't have enough oxygen going to your brain. You don't have oxygen going to your brain cells are not going to function normally. So there's a lot of reasons why, as you can see, that also can cause this feeling of mental fog. Well, what can I do about it? Is there something I can do? My doctor went through all those things. Somebody gave me a good exam. Uh, I told my doctor I was having these symptoms. They took me seriously. They looked for medical problems. They did proper blood work. They may even have you go see a neurologist and undergo some testing. What if they can't find an explanation? Is there something that I can do? Is there something all of us can do right away if you're experiencing brain fog without even going to your doctor? Yeah, there are. There absolutely are things you can do that can improve brain fog. Good sleep hygiene. We talked about it before. You should be looking at 8 hours of continuous restful sleep. Good sleep hygiene means I'm going to bed at a certain time, and getting up at a certain time, and it should be regular. There are things you should do, in preparation for going to sleep, things that may help to relax you, reading a book, listening to music, something to calm you down. You shouldn't be drinking, caffeinated beverages. You shouldn't be drinking alcohol to try to promote sleep. You shouldn't be watching TV in your bed, and especially, or working on computer games or other things that are opposing, the relaxation state. You should be, in an environment that doesn't have other distractions, other noises. You should be getting up at the same time every day. You know, Oversleeping or having erratic changes in the times you sleep are disruptive to the health or the hygiene of a good sleep that's going to let that brain function normally. Cardiovascular exercises. Everybody should be doing 30 minutes a day, 5 days a week. Now, why? Well, it's good for your heart, it's good for your lungs. We all know that. The exercise itself, improves perfusion of blood supply to the brain. It helps flush out debris that can get accumulated in these especially these tiniest little arteries. Uh, but in addition, the cardiovascular exercise affects the neurotransmitters in the brain. There are neurotransmitters that increase our level of alertness, our uh, awareness, our ability to multitask, simply by doing 5 days a week, 30 minutes a day. So it's not just good for your heart, your lungs, but also for your cognitive functioning. Limit caffeine, excess caffeine. Even though you think I'm tired, I need to drink more caffeine to stay awake. It's not healthy. It is more of it's like that hyperadrenaline state we talked about earlier. That exaggerated fight or flight response or those panic attacks. Alcohol, you would think because it's sedating me, I'm going to be able to sleep better and I'm going to get a better night's sleep. I'm going to relax. Not the case. It disrupts your REM sleep. So it doesn't give you a normal, healthy sleep pattern. There are things you could use, though. If you're trying to establish a good sleep hygiene, uh, you have to plan it. What time am I going to go to bed? What's realistic for me to go to bed? What time can I realistically get up? How can I get that 8 hours, in? What alterations in my life do I have to do? Uh, what about, supplements? Is there anything I can take to help me fall asleep? There are. There are things that absolutely can help you and can be safe that will not negatively affect your brain, that will not leave you hungover the next day. For example, melatonin. Up to 10 milligrams of melatonin at night should not leave you hungover. It's a restful uh, uh, herbal product that will facilitate sleep. L-theanine, lemon balm. These are all herbal products that are frequently in over-the-counter sleep agents that you could pick up at the supermarket, the pharmacy, and they're not going to alter your thinking the next day. But it's a way if you're struggling to figure out how do I make this sleep hygiene work? I can't fall asleep normally. Think about what you're doing. What can I do to change that? Chamomile tea, warm milk. The tyrosine, the tryptophan, excuse me. Just like eating too much turkey can make you tired. So there are things that are safe, easy that you could do to try to get you to fall asleep and stay asleep. What else? I thought this might be interesting. There has been studies on what we should be eating to improve our brain function. And I think of the many that are out there, the one that I thought was really uh, most clever and I think most useful is the mind diet. That's why I wanted to spend a little time on this. It basically is a combination of two diets that are very popular already. The Mediterranean diet, which, as you know, reduce cholesterol, increase fruits, olive oil, avoiding all the saturated fats, lean meat, fish, as opposed to red meats, and the DASH diet, which, to stop hypertension, again, limiting salt, limiting the red meats. So there's 10 things, 10 foods that help improve brain function. And I have these listed here. These are not these are not scientifically proven studies, double-blind studies that the FDA has approved or anything of that sort. These are studies that researchers in nutrition have compiled uh, to come up with the healthiest suggestions. There are no specific quantities or grams or ounces of these items, but these are things that you should increase in your diet to help you. Green leafy vegetables, spinach, kale, these darker green are the most healthy, the antioxidant quality to prevent injury to the nerves throughout the body, especially the brain, have been proven of value. Increasing all other vegetables as well, uh, except you avoid the starchy ones. They're not helping you. They're increasing useless calories. They're not giving you the kind of uh, nutrients that are helping to fight inflammation in your body, to fight, the abnormal oxidization, oxidative stress is the term of our nervous system. So you really want to stick with green leafy vegetables, increase the overall other vegetables except for the starchy ones. Berries. Berries are great sources of antioxidants, nuts, are great for antioxidant, omega-3 fatty acids. Uh, Same thing with the whole grains. Fish, huge amount of antioxidant, omega-3, in fish, poultry. What about wine? Should we be drinking wine? Should we be drinking alcohol? Alcohol is a neurotoxin. Alcohol is a neurotoxin. If you're drinking alcohol on a regular basis, you can be damaging permanently the nerves in your brain, the nerves at the ends of your fingers and toes. That's why so many people who drink alcohol on a consistent basis, you don't have to be an alcoholic, but people who are drinking alcohol on a consistent basis come in to see me with numbness in their hands and feet, and they'll think, oh, I have a couple cocktails and maybe a glass or two of wine with dinner, and I'm not an alcoholic. I don't feel I'm not intoxicated. I'm working. I'm still, high functioning individual. But alcohol in general is a neurotoxin. Wine is debatable. There have been studies that have shown benefit from red wine. There's a component. I think it's resveratrol. I think that's the term, where they think it might have benefit in protecting the lining of the arteries. We don't know. It's never been proven, but there are studies, one out of France, one out of Italy in particular, that showed benefit by drinking, 2 glasses of red wine every night and reducing your risk of heart attack and stroke. You know, uh, most most individuals, most researchers will say, limit your alcohol, including wine. A woman should drink no more than 1 glass in a day, max. A man should drink no more than two in a day, because beyond that, the negative effect of the alcohol far outweighs any potential benefit it would have on the lining of the arteries and protecting you from heart attack and stroke. The Mind Diet says don't eat these things: butter and margarine, cheese, red meats, fried foods, and all the good stuff, all that wonderful stuff that the kids brought home from Halloween, the candies, the sweets, the pastries. And this is due to, you know, uh, unhealthy fats that are in these substances, that are in these foods, and also things that you don't think about: preservatives, coloring agents, stabilizing agents, flavors that are artificial chemicals. The body's going to metabolize all this, just like it metabolizes anything that you eat, except that when you're eating these artificial substances, the waste products or the products that are produced can be harmful. They can produce something called free radicals. Free radicals do occur naturally, from metabolism of what we eat. But if you're eating these artificial chemicals in excess, or if you're exposed to certain pollutants in the environment, uh, air, water, uh, it can happen with certain chemicals that we're exposed to, insecticides. These free radicals directly can kill nerve cells, and other tissue. Uh, these antioxidants that we have in the Mind Diet that we talked about earlier, these antioxidants are what help to prevent the damage, the formation of these free radicals. So that's why those supplements, or those nutrients are important, as well as supplements for those antioxidants. Those are all also important. But we want to try to avoid these because it's more than just putting weight on our cells and increased salt and increased fat, because that's what you have here. You have increased salt that causes your blood pressure to go up. You have increased glucose. It's going to cause your sugar to be poorly impaired. It's increased fat, cholesterol, and triglycerides to harden our arteries and cause us to be at risk for heart attack, stroke, kidney failure, peripheral arterial disease, you name it. What else would help? Stress management, relaxation techniques can really help improve one's function, if nothing else, to eliminate that constant distractibility, that relentless rumination of thoughts that we talked about earlier when somebody is anxious, or if they're sad, or if they're frightened. or if they're angry, these thoughts that keep running over and over in our brain, they keep playing and distracting us from normal thinking. Mindfulness, simple, easy, look it up, simple, easy practices that you can do to try to focus on something other than that which is constantly running in your brain like a record that's skipping. Uh, I think one of the most common ones that I see my own patients using is breathing exercises, where they could be mindful breathing, where if you think about your breathing, you could be doing whatever else you normally do. You could be at work, you could be walking, you could be cooking, whatever. Uh, and just think about your breathing. We do it, we all breathe, but how often are you actually consciously thinking on about what it feels like with the air going in your nose and out your nose and in your nose? And if you do breaths where it's a 4 second breath in, a 4 second out through your nose, and focus just on that without talking about it in your head. We all have this chatter in our head. We talk to ourselves. You have to try to practice to just focus on the breathing without actually having your brain say, you're breathing in, you're breathing out. Did you do the laundry? How am I going to pay that damn bill? What's that kid going to tell me next that's going to upset me? You need to focus on your breathing. Or if you're walking, you can focus on your walking. Every step, I feel it. I feel my foot on the ground. Now let me lift it up. Now I feel in the air. Then I'm going to put the next foot down. I could feel it. And then we lift the next foot up. Focusing, altering your attention to something which is healthy, which is keeping you alive, is going to help you eliminate some of that distractibility and help you focus. Exercise we talked about earlier. Increase socialization. It is healthy for your brain. It stimulates your brain when you are active, when you're interacting with other individuals. COVID has been a national catastrophe for psychiatric illnesses in this country. It has become epidemic because of social isolation in so many individuals that could not interact with any other humans, and that isolation. We're not creatures that are supposed to be living in isolation. So by increasing your socialization, talking to other individuals, spending time with other individuals, doing things with other individuals helps your brain. It stimulates your brain. Spending time with people that you love, close friends and family, also stimulate your brain. Finding new hobbies. Think about the brain as being this great big mass, this big hunk of tissue, and most of it is asleep. Most of it is dormant. 90% of our brain is dormant, which tells you that, heck, I can actually stimulate other parts of the brain, turn it on. And this is one of the things I do with my patients who have early dementia, where we know that they've had premature brain cell loss. They've developed memory issues, short-term memory, longer-term memory, and they want to try to improve what they have, maintain what they have, and if get better, even more a worthwhile endeavor. And what I have them do is these kind of activities. You want to increase your socialization, your activity levels. You want to do mental exercises, word searches, crossword puzzles, Sudoku, card games, board games, checkers, dominoes, puzzles, putting puzzles together. Anything that's going to force you to use immediate recall, your immediate short-term memory. What am I doing? What's the rules here? What card did they just put down? Am I going to keep this card? Which way am I going? What letter could this possibly be that I'm looking for? Anything that's going to stimulate your brain in that way can actually carve out or activate new pathways in the brain for you to learn new information, retain new information, and improve your ability to concentrate and focus. There's two products that I keep seeing on researching this topic that could be useful pharmacologic prescription things, supplements, prescription that could potentially help somebody with brain fog. I just wanted to share it with you. Um, Again, no good FDA study for the first one, this N-acetylcysteine. This is an herbal product that we know is very good at reducing inflammation. Injuries to the brain, to the nervous system, as we talked about earlier, can be direct toxic effect from chemicals. It can be due to inflammation of the nerves. It could be due to uh, the development of free radicals. But this is one of the things that we can get under control in reference to inflammation, whether it's post-viral from COVID or other autoimmune diseases. By reducing the inflammation, the nerves function normally. There's less damage to the nerves. The nerves can heal. This N-acetylcysteine is a supplement that breaks down in the body to cysteine, which is an amino acid, which then can be used, or I'm sorry, uh, excuse me, that then makes glutathione. Glutathione is an anti-inflammatory agent. It's a very powerful anti-inflammatory agent that has benefit throughout our entire body. This kind of anti-inflammatory approach is useful not just post-COVID or other viral infections of the nervous system, but inflammation throughout the body. For example, in HIV, it's been shown to help those individuals to reduce uh, damage not only to the brain, the nervous system, but to other organs. Um, in flu, oftentimes the pulmonary doctors will use this supplement in trying to eliminate damage to the lungs and also the blood vessels, from whatever disease an individual has that's attacking their lungs and causing them to be damaged. We've seen it in GI to be of benefit. Let me think what else. Uh, Autoimmune diseases, you know, rheumatoid, Sjogren's. So it has a lot of benefit in inflammatory diseases other than just what we're talking about here today. And it's something that might work. It may not, but if you're looking for something that's safe, that has at least a good track record and shouldn't have, any significant major side effects, think about this. What about guanfacine? This is a prescription medication. I use it for adults and teenagers who have attention deficit disorder. It is not an amphetamine, it's not a stimulant, but it does improve cognitive functioning. It improves levels of alertness, focusing, concentration. It also has some improvement psychiatrically in combination, with other anti-anxiety, antidepressant medications. So it does help to improve functioning of the brain, heightening its awareness. It's something to think about. What about other supplements? Well, they're listed here. Every one of these, at least anecdotally, has been shown to have some benefit. Fish oil, because of the omega-3 fatty acids, is a great anti-inflammatory agent. So is ginkgo biloba. I don't think it really helps people with dementia, but it does reduce inflammation. The choline, that goes on and produces something called acetylcholine, which is part of our nervous system's transmitters. Theanine's a tranquilizing or calming agent. The phosphatidylserine supports tissues throughout the brain and body. And inositol is a naturally occurring protein that supports conduction along the nerves. Ginseng, anti-inflammatory, antioxidant. Vitamin C, E, B, all are necessary to support the health of the nerves. They're all building blocks. And NIH is now studying these agents as well as other supplements that may be of value. We should be getting that information the next year. If you're somebody who thinks you're having problems beyond what should have been normal for you, and you've given it plenty of time for things to heal on their own, you may need to have this looked at. I would start with your own family doctor to see if you have any of these medical problems that could be reversed. Sometimes you may need to have what's called a neuropsychological evaluation, which is this in-depth analysis of your intellectual functioning. It takes about 4 hours. It's a long, in-depth analysis working one-on-one with a neuropsychologist to look at not only things like short-term, long-term memory, but abstract thinking, reasoning, complex problem solving, sequencing, organizational skills, because each part of the brain controls different things. So it helps us to see what's causing your problem, the severity of the problem, and then help us design a proper treatment program for you. And yes, there is cognitive rehab available. I'm going to stop now because I know it's after the hour that we were allotted, and because it is getting late, I'm going to take a few questions. So if we want to have our moderator, go through some that you
Yes,
think might be best.
this was really wonderful, Dr. Matarese. I benefited myself. Thank you very much. I will go into questions. I just wanted to remind people that I posted the evaluation link and the recording link. The recording will be checked out by our media team and probably be posted within a week. So I have both links that are in the chat box. If you could kindly fill out the evaluation, it's really important. We want to hear what you thought of the program, and also we take suggestions for future programs. So thank you, everybody. And I'm going to go to the chat right now. Let's see what we got. Okay, first question. Is there a positive correlation between low blood pressure when you take metoprolol and brain fog? For example, this participant only has brain fog when his blood pressure is low.
Absolutely. We need our blood to feed our brain. Our brain needs the nutrients that the blood carries and the oxygen the blood carries. If our blood pressure is too low, it can't perfuse the entire brain. Your brain needs this pump, this forceful push of blood to get into the furthest extent, the furthest reaches of the blood vessels. If the blood pressure is too low, the blood is not going to perfuse or penetrate into the deepest portions of the brain, so that the tiniest little blood vessels may not get enough blood supply. The brain cells are being deprived of blood, so they're not functioning normally. And if that continues, brain cells can die. So somebody whose blood pressure is too low absolutely can cause brain fog. It can also cause you to be lightheaded, off balance, cause you to fall, cause you to faint. Um, so it's a potential, and then consequences of falling, can be potentially serious. So if your blood pressure, is too low from the medication, your doctor needs to alter it. There's other medications for high blood pressure and/or rapid heartbeat, whichever you're taking it for, that can be used if you're somebody who's just too sensitive. Oftentimes, it's just a dose adjustment. Um, Having said that, sometimes we find this class of drug called beta blockers. They can sometimes also give you this sense of mental fog. And again, it is something that is individual. So if you find, I mean, you know your body better than your doctor does. If you think there's a drug that you're on that is negatively affecting you, talk to your doctor, your nurse practitioner, your caregiver, and tell them I am not functioning the way I normally did prior to this drug. Don't let them, uh, poo-poo your response. Many times patients will have symptoms from a drug that aren't listed, in the list in the PDR in the physician's desk reference book. Uh, that doesn't mean you're not experiencing. We're all unique. We're individuals that are different from everybody else. The combination of drugs that you're on and your genetic makeup is different than anybody else in the world. So, there may be things you're experiencing. And as I said earlier, remember, if you're taking more than one drug can negatively affect the other drug, not only directly causing it to build up in the body, uh, and causing you to become toxic, but having the drug's effect more exaggerated. For example, a drug that's limiting the metabolism of metoprolol is going to cause your heart rate to go too slow. It's going to cause your blood pressure to slow down, and it can have consequences not just to the brain but your heart too, because the heart needs blood supply as well. You drop your blood pressure too much, it can cause a heart attack.
Okay, next question. A friend of mine who is Chinese told me that her mother is a nutrition practitioner in Hong Kong. She recommends tart cherry juice for helping you to go to sleep and sleep well. I've heard this advice recently from another source. Is there any reinforcing information that supports this advice?
So, so many of the herbal products and supplements that we take are anecdotal reports. They've not been proven, but we see them being of benefit to individuals, and it's really a trial and error. Cherry juice has become a very popular item, not just for relaxation, but also we believe antioxidant effect. So it can help anxiety, as well. So it is becoming a more popular supplement in the States. Has it been proven? Has there been any studies? No. But looking at those vitamins, that list of vitamins I showed you before as well, there's no major study that's been proved by the FDA. It's really a trial and error to see what works for you.
Just to comment, this was so helpful. Thank you so much, Dr. Matarese. So much value.
Oh, thank you so much. I appreciate that.
Next, thank you. It was very helpful. Excellent presentation. Thank you. How
Uh,
long does it take for guanfacine to take effect for people with ADD?
Say it again, please.
How long does it take for is it guanfacine
Oh, Grafisa. Okay.
to
Uh,
take effect for people with ADD?
you're looking in most cases. I think if you look at a 3-week trial in most medications, by that point you're going to see the maximum effect of that medication. It's 1 or 2 milligrams. So by the time that first prescription is ready for refill, with the 1 milligram, if you're not noticing improvement, typically we crank it up to 2 milligrams at that point. If we don't see improvement a month after that, we switch to a different medication.
Okay, let's see what's next. Can long COVID aggravate arthritis pain?
Yes, yes. We believe, as I said earlier, COVID activates the immune system. It causes these protective proteins, antibodies that are designed by our immune system to attack the invading organism to try to kill it. The problem is, we suspect with long COVID, it overactivates the immune system, causing these proteins to start attacking our own body. We see it in the nervous system by attacking the lining of the nerve, stripping it, or attacking the proteins of the nerves that look like the virus, causing the nerve cells directly to be damaged. But it can also affect other body parts. In other areas can be inflamed. The joints, the muscles. If you already have an underlying autoimmune disorder, such as arthritis, it can be aggravated by any infection, not just COVID, any infection. Your immune system getting turned on, getting overly activated can aggravate those other areas. So your joint pains could be worse, your muscle pains, headaches, the nerve, symptoms that go along with pinched nerves, all can be aggravated.
And then just a bunch more very informative. Thank you so much.
Thank
Uh,
you.
appreciate the information. What causes brain fog and Parkinson's?
Well, that's a difficult question because initially, if you have somebody who has true Parkinson's disease, there should not be intellectual impairment in true Parkinson's disease. But what we have come to realize is that Parkinson's disease, or Parkinson's, the picture of Parkinson's, can be due not only to true Parkinson's disease, where the brain stops making a particular chemical called dopamine, but also it can occur from other degenerative diseases of the brain. Things, conditions like Alzheimer's, not true Alzheimer's, but other conditions where the brain cells die prematurely. There's something called Parkinson's disease with dementia. There's something called Lewy body disease, um, striatonigral degeneration. There are other degenerative diseases that look like Parkinson's disease, but it's due to degeneration in other parts of the brain, including those parts of the brain that affect memory. Something else that oftentimes gets mistaken for Parkinson's is something called NPH, or normal pressure hydrocephalus, where there's this accumulation of these water sacs in the center of our brain, and it can affect the way you walk. You look like you have Parkinson's disease, but you also have memory problems, You can have urinary incontinence that goes along with it. So there are things that look like Parkinson's that can have memory disorders, and they end up oftentimes being not true Parkinson's disease, but these commonly referred to as Parkinson's plus syndrome. So if you're in that situation, you're somebody who should see a neurologist, and there are neurologists that are specific Parkinson's specialists. I mean, Alexandra Landon in our practice, that's her area of expertise, and she's local and she's phenomenal. But you should have that looked at.
A bunch more thanking you.
Thank you. Thank you.
And then can long COVID cause neuropathy?
We think COVID can cause anything. The more I deal with post-COVID symptoms, the more I realize it can damage any part of the nervous system. It's not just the brains of the cell, excuse me, it's not just the cells of the brain that can be damaged, those neurons, but neurons anywhere in the body. And truly, I have had patients with COVID who have had not only brain damage, but I've seen and seizures and cognitive impairment and strokes. The other issue, I don't want to forget, COVID also can cause coagulopathies, meaning clotting abnormalities that can cause blood vessels to become plugged, which is why we see strokes. The vasculitis or the inflammation also can cause these arteries to become plugged and cause strokes and or heart attacks. So uh, it is a major, it is a real demon, but it can damage the ends of the nerves, causing neuropathy. Yeah, you name it, just about any part of the nervous system I've seen, including the muscles. The muscles are directly connected with the nerves, and can also be damaged. Inflammatory diseases of the muscles themselves, myositis, where you're losing muscle mass, you're becoming weak, painful cramping. So yeah, absolutely.
How does brain fog affect peripheral neuropathy?
Well,
Is that
there are
the
two
same?
different parts of the nervous system. The brain fog has to do with the central nervous system, which is the brain and spinal cord. The peripheral nerves, the nerves that leave the spinal cord, are what cause peripheral neuropathy. So brain fog doesn't affect the peripheral neuropathy, but whatever disease is causing your neuropathy can also cause you to have cognitive problems. Whatever disease is causing you the brain fog may cause the neuropathy. So you're somebody in that situation who needs to see your doctor. What's wrong with me? Do I have any underlying medical problem here? Is this really all post-COVID? Do I have diabetes? Do I have low thyroid? Do I have an autoimmune disease? What's my B12 level? What about my folic acid level? Do I have an inflammatory disorder? And do I have an malabsorption syndrome? Do I have a GI, inflammatory bowel condition? Do I have celiac? I mean, you need to have, a good medical doctor. I'm sorry, you need to have a good medical evaluation by your doctor to help you figure out that connection.
How can I contact Dr. Matarese? I would say the website, right? The Capitol Health website, is it Center for Neurosciences?
Um, yeah, we have the office. I only see patients at the Langhorne office. So if somebody really did want to see me, it's best to reach me through the Langhorne office. But you can get contact info for all of us, including all the subspecialists that are part of the practice by going on to the Capitol Health website, and I think you can provide them that link, and then just click whatever department you're interested in neurology, and meet the doctors. And every one of us is listed there. You see our photograph, a little bit of our really limited CV, but gives you a feel for what our expertise is, because we all do try to do the best we can in our areas.
And I can put that on when we finish up. Does the 30 minutes of exercise per day have to be continuous, or can it be smaller durations of time during the day that add up to 30 minutes?
The My understanding, I'm not a neurophysiologist, but my understanding is that you want a continuous 20 to 30 minutes a day in order to get that heart rate up and to get the benefit that you need. However, what I know is that not everybody is going to be able to suddenly start a 30-minute daily exercise. Many of us are deconditioned. Many of us have not exercised on a regular basis. Many of us have other medical problems that prohibit us from exercising, lung problems, heart problems, arthritic problems. You do the best you can. You do what you can. If and you may want to start slow. Try 5 minutes of something every day. And by cardiovascular, I'm not saying running around the neighborhood or doing weightlifting. I'm saying a brisk walk if you can, a treadmill, stationary bike. There are these wheels that you put on the ground when you're sitting, and you can kind of spin the wheels when you're sitting. But armchair exercises are just as good. Sitting there, bringing your knee up to up towards the ceiling, so knee raises, and then straight leg raises, and then overhead reaches. If you do 20, bring the knee up and down 20 times, and straight leg raising 20 times, and bring the arms overhead 20 times. I mean, something, whatever you can handle, you do whatever you can, and then try to gradually build it up to 20 minutes, 30 minutes, 5 days a week. But anything you can do is better than not doing anything at all. It all helps.
Exceptional presentation. Much thanks. Thank you so much for this insightful presentation. Thank you for making a complex topic easy to understand.
Oh gosh, I was afraid I was going too fast and hitting you all with too much information. I really appreciate that feedback. Thank you.
Yeah, I thought it was wonderful. Not just saying that.
Thank you.
Thank you. More thank yous. Thank you, thank you, thank you. And I think that's it.
Folks, I wish you all continued good health. Uh, my particular expertise is not, brain fog. I'm not a brain fog expert. My area of expertise is traumatic brain injury, concussion, and stroke. All of us, any well-trained neurologist in our practice absolutely could handle this kind of evaluation. I'm honored anybody that might want to see me. I'm not pushing for that. Believe me, I'm a busy doc already. But, we appreciate it. We appreciate you looking at our system. I mean, we're so blessed to be basically university level quality subspecialists in the world of neurology in your own backyard. I mean, who else can say that? Where you have these folks that in the past we'd have to drive to Philly or into New York, to get this kind of subspecialty expertise, and now we don't even have to take a major highway. You don't have to pay for parking. It's pretty great. Well, guys, I wish you all continued good health, and hopefully you'll enjoy further presentations in the series.